Hi everyone, my name is Rich and I'm from the Physiotherapy team at Rotherham NHS Trust. Today I'm going to be running through some lower body exercises which are all looking to increase your muscular strength, endurance, coordination, but also the range of movement around your hip and knee. These exercises are perfect for anyone who is suffering from hip and knee arthritis, but also anyone who has recently had total knee surgery. I'll run through each exercise and exactly what we want, give you a demonstration and a bit of a description of how to complete the exercise safely, using very little equipment or equipment that you would generally find in your household. I'll also offer progressions and ways to make the exercise a little bit harder and a little bit more intense as you gradually progress over the coming weeks. To start with, I'll run through some mobility drills and a few stretches, then we'll get into the main bulk of the session, and like I say, I'll offer any sort of progressions as we go along. So the first one we're going to be using, obviously I've got a plinth, so I'm going to be using this. This one would be ideal if you can do it on the bed to start with, so these are your mobility and stretches to begin with. So the first one is what we call knee flexion, so that's bending of the knee. So it's really important that we increase our range of movement or try and maintain the range that we've currently got. So to start with, you're going to sit back. Like I say, you can do this on the bed, you can support your upper body as much as you need to, but all we're going to do is slide the heel back as much as you possibly can, hold it for a few seconds at your tightest point, and then slowly slide it back out. And then bring it on to the opposite. So like I say, you're sliding it back to the point where you feel the most tension or the most tightness, the most stiffness, holding it for a few seconds and then sliding back out. You can also do this on a chair. So if you're seated in a chair, you can simply look at sliding your knee back and then taking it back out again. Make sure you work on both sides, and like I said, work into the biggest range you possibly can. We want you to work on this one for around 15 repetitions. Again, you're just working at your own pace. Remember, as you're sliding your foot back, you will get a little bit of discomfort, which is absolutely fine and normal. That is what we would expect. But don't push into too much pain. The next one is the opposite, so we're looking at straightening your knee. So from this position, I want you to shuffle forward just so your heel's dangling off the edge slightly. And I want you to try and start with, I want you to try and just push your knee down as straight as you possibly can. If you feel that is a little bit tight, all I want to do is hands over the top and just gently push down into it as well. You're not applying too much force, but just above the knee, just gently pushing your knee down straight. A good tip, if you place your hand underneath, you should be able to squash your fingers below your knee. Again, with this one, you may get a little bit of hamstring pain, so a little bit of tightness at the back of your leg. So all we want to do from there is just slightly lean forward, and imagine it being like elastic band. You may feel a little bit of tension increase as you move forward. If you do, I just want you to push down and forward, hold it for around 30 seconds, and then gradually ease off. Again, you could then move on to the opposite leg, and exactly the same on that side. Again, you're just pushing down, feel if you can close that gap between your knee as much as you can, and feel that tension at the back of your leg. Perfect, so there are your two seated ones, so like I say, you can do them on your bed. I mean, as long as you can get to the end and your heel can dangle off, that's absolutely fine, but a couple of them you can also do in a seated position. Just going to move this one out of the way. So the next ones, they're all in standing, so we're going to start off with hamstrings. So again, like I've just discussed, that little bit of tension at the back of your knee. I'm just going to use the dining room chair just to help me support and stay upright while I hold this position. So from here, we're going to straighten one leg out, bending your back leg, and we're going to sit into it and try and stick your bum back as far as you can. And again, you'll feel the tension at the back of your leg, almost like an elastic band. Take it to the point where you get the most tension, hold it for around 30 seconds, and then ease off. Like I say, you then do the opposite leg, sitting back, sticking your bum out, feel that tension at the back of your leg, and then gradually ease off. So again, like I say, I'm just using the chair, just moving from the front, just simply using the chair just to help keep my balance so I can concentrate on the stretch rather than the shaking and wobbling. And then you do the opposite side. Excellent. So that's another hamstring stretch. Next one is marching. Again, we can use the chair if we need to, but it's looking at increasing that bend of your knee, but also the range of movement coming from your hip as well. So from a standing position, all we want you to do is march on the spot. Again, it's slow, it's controlled, don't rush anything. If you needed to, you can also bring that chair back in, just to help with your balance again. So again, like I said when we were seated, around 15 repetitions is more than enough to start your session. Your marching can also be done in a seated. So just shuffle towards the edge of your seat and simply complete your marching while seated. Excellent. And then your final stretch and mobility drill, you are going to require a pillar. So all we're going to do is a pillar squeeze against the wall. So I just want you to stand with the wall. If it's one particular knee that you're struggling with, or if that's a knee you've had operated on, working on this one, so this would be your operated or affected knee. And all we're going to do is push back, straighten your knee against the pillar. So you're trying to squeeze the pillar as tight as you possibly can. Once you've pushed it back and held it, we're to hold it for around 10 seconds if we can, slowly ease off, and then push back again. If it's both knees that you're struggling with, obviously, we would then switch it over, squeeze that pillar back as tight as you possibly can, really straighten that knee out, and then ease off again. Push back, straighten, and then ease off. So just a pillar, just fold it up, and then squeeze in as tight as you possibly can. So there are your stretches and mobility drills that we want you to work on. Like I said, around 15 repetitions on each one. If you feel like they're really working and you're feeling the benefit, obviously you can increase the amount of times you're doing this throughout the day or increase the repetitions each time you do them. There's no right and wrong in terms of how many of these you can and can't do. Now we're moving into the main bulk of the exercises. Each class, so the arthritis class that we do and the total knee replacement class that we do, we work on these exercises for 2 minutes. Like I said, they're requiring very little equipment or equipment that you would generally find in your household. I will move on to the progressions as we go through and demonstrate the technique and discuss exactly what we're after. So the first one is your squats. Again, you may need a dining room chair to help you with your support on this one. Remember, all these exercises are looking at increasing your muscular strength, endurance, range of movement of your knee and hip. So they're all really important in terms of recovering from that operation or looking to increase, like I say, your strength and endurance during your arthritis or your flare-up episodes. So, like I said, first one is your squats. Again, chair if you need it. I'm going to stand this way on to start with, just to give you a side view, and then I'll turn to the front as we move on. So your squats, feet are shoulder width apart, toes are pointing straight out in front. We're going to almost imagine you've got another chair behind you, holding onto the one in front. We're going to squat down, try and touch the chair behind, and then slowly stand back up. While I'm squatting down and standing, I'm trying to keep my knees in line with my toes and pointing straight out in front. Like I said, I'll turn front on so you can see from the front. So again, if you don't need that support as much, feet shoulder width apart, toes pointing straight out in front, squat down and slowly stand back up. If you find that this one is becoming a little bit too easy and the 2 minutes isn't quite challenging enough, what you can do is take the chair away and you can add a little bit of weight. So at home, you might have a 2 litre bottle of pop, couple of tins of food, or a shopping bag where you can just put a little bit of weight in and hold it in front, and then you can perform your squats as normal. Make sure with your squats, guys, every time you're standing up, I want you to stand as tall as you can and tense your bum muscles. Excellent, so there you squats, that's your first exercise. So like I said, 2 minutes on each one. If you need a little bit of rest in between, that's absolutely fine. 60 to 90 seconds is roughly what we would do in class. Your next one is what we call hip abduction. So this one is targeting your bum muscles, really important for supporting your knee, but also obviously increasing your hip strength. Again, I'm going to be using this standing room chair. This is just to help me support and balance throughout the exercise. So from here, toes pointing straight out in front, we're going to stay upright as tall as we can, kick one leg out to the side, and then slowly fetch it back down. Once you've done a couple of minutes on that side, you can then switch it over, and then do the opposite. Now if you've got any ankle weights at home, even better, even more challenging, you can just strap the ankle weight to the bottom of your foot, and it just adds a little bit more tension and a little bit more weight to complete the exercise. Perfect, so that's what we call hip abduction. Moving on to your next one is step ups. So with your step ups, ideally you'd be using your staircase. If you've got a portable step, that's even better. So with step ups, we're going to lead with that affected knee. So if you've had your left operated on, I want you to focus on leading with that as much as you possibly can. If it's arthritis you're suffering with, and it's in both knees, obviously do alternate. 2 minutes is a long time to be doing step ups, so if you do start to tire by leading with that affected knee, you can then mix it up and do the opposite as well. But all we're simply going to do is step on and off nice and slow. Just a big step on, stand tall, tension your bum muscles, and then slowly come back off. Now a great way of progressing this one is to add a little bit of weight to it. So a shopping bag in each hand, a couple of tins of food, arms relaxed down your side, just imagine you're carrying your shopping, and complete your step ups as you would do normally. Remember with this one, as you step on, we're looking for this knee to stay in line with your toes again, so it's not drifting in or out, stay in line, and you're standing as tall as you can. So that's your step ups. Next one, we're moving on to bridging. So if you can do it on the floor, by all means, that's absolutely fine, but you may need to complete this one on your bed if you struggle to get up and down. So with bridging, we're going to lay flat on his back and have his knees roughly shoulder width apart. I want you to try and maintain that same gap between your knees throughout the whole exercise. From here, we're then going to push your hips up as high as you can, and then slowly control it back to your start position. I turn sideways on just so you get a better view. So from here, maintaining that gap between your knees, pushing up as high as you can, slowly controlling it back down. Again, it's a great exercise for strengthening your bum muscles, really important for supporting your knee, but obviously imparting your strength from your knee. Perfect, so that's what we call bridging. Another way of progressing that one is to simply add a little bit of weight on top of your hip. So we'll be staying in that same position, holding the weight on, letting it relax on top of you, and then you're just having to force that little bit of weight a little bit higher. It's just going to make the muscles work that little bit harder by having to move that extra weight. So that's your bridging. Next one is what we call heel raisers. So again, you can work off your bottom step if you can. Make sure you've got a wall or handrail there to support you as much as you need it. Feet are going shoulder width apart and the heels are slightly off the back of the step. All we're going to do is push down, stand up as tall as you can on your tiptoes, and then slowly control it back to your start. We're going to let the heels just drop below the top of the step, and then push back up. Again, a good way of progressing this one is to add that extra weight to it. So a shopping bag in each hand, a couple of tins of food, and we're just pushing up as high as we can, slowly controlling it back down. Again, I really want you to focus on your alignment. So as you're pushing up and down, your knees are staying in line with your toes and your hips, and they're not drifting in or out. So that's your heel raises. Your next one is what we call farmer's walk. So I just want you to clear a little bit of a runway, around 3 or 4 metres if you can. Shopping bag in each hand, with a few tins of food. Relax your arms as much as you possibly can, and all I simply want you to do is walk, holding the weight. Up and down for 2 minutes if you can. Now the way of progressing this one is to load it up even more, so add even more weight to it. Or another way of progressing it or mixing it up is to drop one of the bags and just hold it in one side. So that would tend to make you want to lean over. So you've got to correct it by staying upright and keeping your shoulders level and your hip level. So you just be carrying in one side. And then you'd swap it over onto the other arm. So like I say, if you are doing single bag or one-sided, make sure your shoulders are level, your hips level, so you're not leaning over too much. Finally, it's what we call our sit to stand. So we're going to bring this dining room chair back in. And we're also going to use a little bit of weight for this one as well. So again, bring that shopping bag back in, loaded with a few cans or tins. Weight in front, just hold it out in front. Feet are going to be shoulder width apart and toes pointing straight out in front. From there, we're going to stand up as tall as we can. Like we did with your squats, we're going to tense the bum muscles and then slowly control it back down to your start position. Again, I really want you to focus on your knees so that they're not drifting in or out and they're staying in line with your toes and hips. So they're always roughly shoulder width apart. Again, another way to progress it, simply increase the weight. By increasing the weight, you're just going to put that little bit more demand on your muscles and help increase your muscular strength of your knee and hip. Perfect, and that's finally your sit to stand. So like I've said, I want you to start off by doing your mobility drills and your stretches, around 15 repetitions on each one. When you get to your main bulk of your session, 2 minutes on each exercise. Start off with the first ones I've shown you, and then look at moving on to the progressions as you go on and you find the exercise a little bit easier and a little bit more manageable. Remember, you will get little flare-ups during these exercises. It doesn't happen with everyone, but we can't pinpoint who it will happen to. So to start with, it may be worth doing them one day, then miss a day, then back in, and so on and so on. So you're doing a day on, day off. If you find that you're managing those okay, you then can look at introducing them to do them on a daily. So you're doing them simply every day. When you get to that point and you're managing them comfortably day in, day out, that's when we'd look at bringing in your progressions just to make it a little bit more challenging. However, when you bring those progressions in and it becomes that little bit harder, you may have to go back to do a day, miss a day. So it's important that you're managing how well you're coping with these exercises. If you're experiencing quite a lot of pain and discomfort during them or after them, make sure that eases off and you're relaxed before you then look at bringing them back into the next day or later on that day, etc. Hope you've enjoyed this video. If you do have any questions, please get in touch with the physio that you have been seeing, and I'll pass you on to this video to help you with your home exercise plan. Hope to see you all again soon. Thank you.